Research is ongoing into possible reinfection of COVID-19 patients. The reason being, medical experts at the Ga East Municipal Hospital say some recovered patients are back at the facility with renewed symptoms. The notable symptom is choking sensation. GBCNEWS Clara Mlano was at the intensive care and emergency units and reports on the management of mild and critically ill patients.
Referred from a different health facility to the Ga East Municipal Hospital because he had become critical, a bad case of the coronavirus, and he depends on oxygen. For close to 30 minutes, he has the utmost attention as needed to stabilize his condition.
So we are giving him oxygen 15 liters on non-rebreather. And then he's saturating at 98. So at least on this one, his saturation is okay. So we are going to monitor him on this one for a while.
Sadly, doctors here admit that most of those who succumbed to the disease are those in the ICU and therefore receive the utmost care. One's length of stay at the unit depends on how quickly one system responds to treatment. I met a politician at the unit who is fortunately recovering, and in my interaction with him, he describes the experience as dreadful.
In fact, when I came, it was deadly because even I was not able to recognize people. I was not able to talk. I was not able to walk to go and take my bath. I was not able to eat. Nothing. All I could see is connected to this various machine that is all witnessing here. And I realized it has caught a point. Only God can heal. I can say this COVID is real. I never dreamt of acquiring it because how or where I got it to where I am now, I did not go for it. I did not trade for it. It can happen to anybody.
His prayer is to step out of here soon, enjoy the freedom that life offers in the sun, and dedicate himself to sensitizing the public on the coronavirus.
There was a time I feel like going to toilet, excuse me, that way. But no one was helping me. My hand was connected to this. Another hand was also connected to another machine, and I fell. So the only option I had was to release on myself. COVID is not a good thing. I'm educating the whole public that please, because anytime you see adverts about COVID, don't turn your TV thinking they are wasting your time.
On the other side is the emergency unit with patients with mild symptoms. For one, he did practice all the safety protocols, yet he contracted the disease.
Honestly, I can't tell because I've really been cautious, very, very cautious. So I can't tell. I've always practiced everything. I think for some of us lying here, it's evidence for people to see that the disease is real. Everybody needs to be very cautious. Let's not take things to chance.
Another tells me he has no idea where he could have contracted the disease since he never stepped out of his apartment for more than 5 months.
For the past 8 months, I was indoors from my bedroom to the porch, not even to the gate. It took me by surprise. However it has come, what do I do? Face it and put it right.
Since this facility became operational some 5 months ago, Dr. Odumensa and his team of experts have been at the forefront of treating and managing COVID-19 patients. I asked about the dynamics.
I think over time, one of the key symptoms we have always been talking about was fever, alongside cough and sore throat. But we haven't seen a lot of the fever. What we've seen more commonly is the cough and the sore throat. Looking at the current trends, we're probably not recording daily highs as we used to in the past. What I see now are aggregates over several days. So it looks like the numbers are increasing. But if you disaggregate the numbers we are seeing in today's samples we're taking, you probably realize that there's probably a downward trend in the numbers. What we'll probably see more are ill patients, those with comorbidities, because people are probably not seeking healthcare as early as they used to. Again, because of the delays in testing and getting results, people were staying longer in health facilities as suspected cases before finally being confirmed and moved to a treatment center. And of course, as much as possible, the health system tries to cater for the suspected cases and provide them with the best of care, but we may not always have it that way. So that could affect, the quality of care patients get before they are finally confirmed as COVID positive and therefore move to a treatment center where they get the full benefit of treatment. So that could have accounted for why we are seeing more ill patients lately. But definitely, I don't believe we are seeing the high numbers we used to. It's just the aggregates of the numbers that makes it look like the case counts are increasing.
My concern was if there were possibilities of reinfection after one has been certified as clear and a recovered patient.
So once you have done the minimum 14 days plus 7 days isolation, so you've completed your 21 days of isolation, you are seen as having been, or you are seen as having recovered from COVID infection, and therefore having developed enough antibodies to have fought the virus. For such a person, the literature or scientific evidence shows that you're unlikely to be reinfected in the shortest possible time. Here I'm looking at somewhere on the average about 3 months. So if there's going to be any reinfection at all, it will probably be after 3 months. COVID hasn't been with us, when I say us, with humanity, for more than 8-9 months. So it's difficult to tell the full extent for which somebody might be, might harbor the antibodies. So, but for now, I can say that you are unlikely to be reinfected in the shortest possible time. But yes, is there a risk of reinfection in the future? Well, probably yes. Yes, but not in the immediate. Now, lately, for post-discharge, we've seen a number of patients complaining of a choking sensation in the throat, and that's something we need to investigate.
The health experts' worry is the loose life or blatant disregard to the reality of the disease by some Ghanaians, with the mindset that the entire crisis is a farce. Perhaps this, the lifeless bodies of some persons who succumbed to the virus, might give them a change of mind. For GBC News, Clara Mlano reporting.